Right there.
So I'm going to inject you here. It's going to numb both sides, and then we'll give that a few minutes to kind of work. Come back. Hopefully release it.
Hopefully.
Well,
Wow.
we will release it, but I'm hoping we get 100% like straight. Sometimes it lingers like a little bit because the longer it's been going on, sometimes there might be scar tissue in the knuckle, and I can't get rid of all that. So we'll kind of see how much improvement we get. This is just cold spray. All right, big pinch coming. And the burn dissipates in a few seconds. You doing okay? Your pinky also may be partially numb, or this side of the middle finger may be partially numb as the nerves get bathed in this numbing solution.
That's a lot of stuff.
I was just gonna say that.
Be paralyzed after that.
Yeah, it's all temporary. All right, we'll be back in a few minutes, okay?
I'll be paralyzed. Stupid.
We'll be right back.
Now, how do I stop this? Just
Oh, you had to stop.
What? Let's take the Band-Aid off, and then we'll get you in a position here.
Get me in the position.
am I in the way?
You're not. You're fine. Where is the big thing?
I put 2 on that.
Oh, okay.
That big thing was unnecessary.
You didn't like the bulky padded bandage that prevents you from hurting this more?
I thought it was ridiculous. I said, she's gonna do all that?
Yeah,
I said, it must be protocol to do that.
it is. It's just some people get a lot more bruising than you did. Okay, so we're gonna bend your wrist to relax the fibers. Okay, and breathe.
Dear God.
Yeah, see, I knew that was split.
Yes, because it's really tight. Kind of warned you about that.
Yeah, I knew it was split.
That's all right.
It's split right out.
It's been 20 years like that.
Yeah, right. That's okay. So we just do wound care, local wound care. It'll heal. Okay.
Yeah, I'm not worried
It's
about it.
gonna look
Just
scary though. It looks deep because it's deep, but it's
It
okay.
did look
It's
deep.
like you ripped my finger off.
Yes.
I promise your finger's still attached.
I didn't know she had that big of muscles, huh?
But look how straight your finger is.
What? Look at that.
Now this will heal in, I promise.
That's crazy looking.
That's a hole.
Yeah. Because of how long, it's because of how
Holy
long this has been going
mackerel.
on and how tight the skin was. Yeah. That one will probably do the same thing. But
Pretty cool, isn't it?
it's pretty
That's
straight.
crazy.
You mean
Why is
it's,
he got like coming in on these now? I didn't believe
That's
it either.
crazy.
so it's open now. He can move it. It's
Yeah,
over.
go ahead and move it.
Straighten
All the
it.
way up.
Yeah, well, I think, like I was saying, you have some
Oh,
scar
hand.
tissue.
I think my
God.
hand is crooked.
Because I can get it straight when I pull on it, so that's why we're gonna get you to
You
make us.
understand what I'm getting at? I think from my hand being like that, I think it's curved here. Like I can't get my whole hand flat.
Yeah, we'll stretch all that out.
No, but you understand what I'm saying?
I do.
think that's why I can't
Yeah.
get, I can't
You
go
might-
all the way open.
You might need another injection here to
Yeah,
open that up.
see how the line is?
Yeah,
Because my hand's sort of crunched.
yeah.
I don't think I can go all the way open.
What we do typically is have a therapist make you a splint to stretch all that out. Okay?
Mm-hmm.
Because it pretend it's somebody sitting there doing this all
I
day.
can't. This is because these two are always been open.
Yeah,
I
right.
can't get those to go.
Well, we're gonna try stretching it out with a splint, and if we can't get it, then we can try another Xiaflex injection,
Yeah.
or we may need
My
to
knuckle
see if
hurts.
there's scar tissue in the knuckle.
The knuckle hurts on the other side.
This knuckle.
Yes.
Yeah, I think you might have some scar tissue in that knuckle built up from how long it's been like
Yeah, that hurts.
Yeah.
How do you close that hole
Now.
now?
His body's gonna close it, so
See,
we're just
that-
gonna wrap it, and your body's gonna actually heal it with what's called secondary intentions. It's kind of like if you skid your knee, you lose the top layer of skin, and then your body fills it in from the inside out. That's
How
how
about
that's
with my
gonna
hand
help.
then? Is that as good as it gets?
Right now. One step at a
When you
time.
put a split on it?
We're gonna get the. Do you have a therapy appointment already?
I don't know.
We're gonna make you a therapy appointment. Get the therapist to make you a splint because it's custom made and it's removable, and that will stretch more and more of this out. Okay.
That's insane right there.
And then the more that, once I see you, I'm gonna see you back to see where we're at, and then we'll decide what the next step is based on how it looks at that point. Okay.
Does he get antibiotics or something for infection?
We don't usually need it.
Jeez,
I know it looks worse than it is. I promise.
it ripped right open.
That's all right.
I warned you.
Oh, my knuckle.
You wasn't expecting
I
that.
can feel my knuckle hurts. And my hand's numb.
Yeah. Well, because I numbed it.
I know, but if I can feel that now, my knuckle, this is what I'm trying to tell you.
Yeah.
It's gonna be really, like, it's gonna really hurt, because I can feel it now.
Yeah. It'll be sore.
Why is the knuckle? It's on my hand. The back
She
side.
said scar tissue.
Because we're really
Like this
stretching
one.
it. Yep. We're really stretching it.
Alright,
Okay.
yeah. Okay.
I promise.
No, I'm not, I'm
It's
saying,
okay.
the knuckle, I can feel it pressing on the table.
Yep. Because that part isn't exactly numb. I numbed from here up.
Alright.
I didn't numb that knuckle.
So is it Tylenol and Motrin then?
Alternating, yep. I promise that's all
I don't
I
want a
need.
crack or anything like that. That's a joke.
I know. That's why I laugh.
Yeah.
Okay, so
Oh, man.
we're gonna get a bandage on. Let me get that fresh. My face looks
A
weird.
bandage.
And then we'll have you see our therapist. She'll make that removable splint. I'll see you in about a week or so to make sure that it's healing up okay. And we'll go from there.
Then we're gonna go this way.
Well, let's get this one to heal first. You need a hand to use for life. So let's get this guy to heal first, and then we'll talk about we have the medication, tiered for you.
Yeah.
So we're not in we're not in a rush. I just want you functional. But this is what I meant by, sometimes we break up the cord, but there's still stiffness. And so we have to kind of figure out, is it from the joint, like scar tissue built adhesions in the joint from how long it's been bent? Or is it we're missing some of the cord, or exactly where is the lingering contracture from?
And that's just gonna stop bleeding on its own.
Yes, ma'am. We're gonna do a little bit of pressure with the dressing, and then she's already got all that set up, and then it'll stop.
Easy.
Sorry. I figured you needed some pain
That's
down
pretty
around your
amazing.
ankles to keep it off of your
That's
hand.
pretty amazing it split like that.
Yeah,
Yeah.
I wasn't expecting it.
Around what area do you live? Is this a convenient location for you for therapy?
Yeah, I live right here at Avondale.
Okay. Alright, I'm gonna put in the order.
And it's probably gonna wanna close, right? It's gonna lazily wanna close, or no?
Yeah, that's the point of the splint.
Splint.
So it's going to be one that kind of keeps him on stretch so that we prevent that. Yep, that your body has a memory in a sense that it's
Yeah,
going to
yeah.
want to, like you're
Okay.
saying
Like
over
natural,
here.
it's been like this forever, so.
Yeah, exactly. So we're going to work on gently keeping it straight.
Now, if that keeps, it won't
Right there.
keep bleeding. I mean, should he ice it, keep it
I'm
up?
going to ice
What-
it, elevate it, and like you were saying, alternate ibuprofen and Tylenol. Keep the dressing on because it is going to provide some compression, and you need a little bit of pressure in that area to get the bleeding to stop. It's just skin bleeding.
Yeah, I got you.
And then it will heal from the inside out. She'll go over how to do like ointment on it, bacitracin ointment,
Yeah.
and that will help prevent infection. If you notice any, foul odor, any drainage that's
Turns green. It's like.
if it
yeah,
turns
so-
green, then call me right away. If you have redness going up your finger, call me right away. The numbness will last a couple hours, but not much longer than that.
How often should he dress it? Open it up and put the.
I need to see how soon we can get you into therapy. If we can get you into therapy Monday, then I would leave your bandage on until Monday. If it's not going to be until later in the week,
Monday.
hmm cover it when you go
Friday.
take a shower with like a bag. If it's not going to be until later next week, then we'll have to.
You can give me a muddy.
That's what I'm going to go check on.
Right. I figure you can pull some strings and give me a muddy. So I ain't gotta put no bag
Yeah.
on this thing.
Yeah.
She can pull your finger.
She did. I'm just saying. Monday's cool with me.
Yeah. All right, I'll be right back.
Thank you. What kind of thing is you got going on here?
So this is gonna hold pressure on that.
Yeah.
So it's gonna help the bleeding and it's gonna kind of help it stay in position too. Till they get you your splint made.
Yeah, she
You're
just
gonna
went.
make it today?
What's that?
You're making it today?
I'm not making it today. Therapy's gonna make it though. Do you already have your appointment set up over there?
No.
No.
Oh, okay.
You
Why
don't
not?
have, you don't have nothing.
How would I make an appointment? I didn't know it was
So-
gonna bust wide open like that.
Well, normally, we will, I think it's at the last appointment. We will just go ahead and set it up for you. You don't want to go back to what it was. This is just gonna help kind of keep it like that. Until she gets you a fancy one to put on.
I can't get over that.
I see why you watch that.
Yeah, it's like pimple popper.
I honestly didn't know this even existed until I started working with her. And I'm like, I was watching videos and stuff on it. I was like, really? And then I finally worked up the courage and said, can I watch?
That's
I
fine.
love it now. Alright, let me go grab my other stuff real quick and then we'll get you guys out of here, okay?
Wow. That was amazing. That was, we didn't expect that.
No, she said that. Which is this one will do the same. It'll split right here because it's been sitting like that.
I'm done.